All right. So welcome everyone. I know it's been a little bit of a difficult time with everything going on, so I appreciate you being here today and sharing some of your time with me. And I hope everyone is home and healthy and social distancing and just kind of keeping to yourselves during these trying times. And I hope this can provide just a little bit of clarity or answer some questions for you and keep your mind off of things in the meantime. All right, so my name is Andrea Miranda, and I am the nurse practitioner here at the Foundation for Hair Restoration and Plastic Surgery. I do many things here in the clinic, but today in particular, we're going to focus on PRP, which is platelet-rich plasma injections, and on laser caps. So that's Jose, my colleague, he's here also, okay. So those are the two things we're gonna talk about today as medical therapies. If you have other questions about other things that you know that I might do, I'm happy to answer those, but today this is what we're gonna focus on, okay? And again, if you have any questions, we're gonna go over that after. So I'm gonna screen share so that you can see my PowerPoint and see what I'm looking at. So for those of you that are not able to see the video, at least you can listen to my voice. I'll try and read off some of the things so that you can also feel like you're participating, okay? So let me screen share here. All right, so can everyone see the screen? If anyone can just write to me in the chat just so I can.
Yeah.
Okay, perfect. All right, so first thing you need to know, so you're not gonna be able to see me, but you should be able to see the screen, okay? So first thing we wanna talk about real quickly, just so that you understand a little bit more about PRP, are the phases of hair growth. And if you're interested at all or have had any issues with hair growth or hair loss, this is something that you might have heard your clinician talk about. So phases of hair growth. You have your first phase. Sorry, I'm trying to let people in at the same time. This is a little complicated. You have your first phase, which is, wait, Jose, can you help me out here? I don't know what's going on with this.
Just close it.
But I don't have a mouse. Sorry, guys, bear with me. All right. Okay, sorry about that. So you have your first phase, which is your anagen or your growing phase. Your second phase, which is your catagen or your regression phase. Your third phase, which is your telogen or resting phase. And this is the phase that you might be struggling with if you suffer from telogen effluvium, or where they talk to you about your hairs kind of resting and needing to be woken up, if you've ever heard that in consultation, either with ourselves or with any practitioners in your area. So you need to understand the process of these three phases, and then the last phase, which is your shedding phase, if you're experiencing profuse amounts of shedding, or even the normal amount of shedding that we experience as, you know, as normal adults. So each hair is going to work individually of the other hairs, meaning you can have some hairs that are in catagen phase, some hairs that are in anagen phase. And this is important to know so that obviously if we were all in the shedding phase, right, we wouldn't have any hair. So this is important to know just so that you can understand the patho behind why we do PRP and why we think that it works. So the pathophysiology, without getting a little bit too complex for lay people, is that your platelets have growth factors. Many of them, the one that I'm referencing here is your platelet-derived growth factors. And so they restore favorable signals to your follicles that promote that change from that telogen to anagen. And they also increase angiogenesis and decrease inflammation. They improve the follicle surrounding environment, similar to the way that you could think of, fertilizing your soil before planting some flowers, right? That's going to improve the area, your environment for your flowers or for your plants to help it grow better. It can increase your anagen or your growth phase. And then in order for the PRP to be therapeutic, you want to make sure that whether you're working with us or wherever you're calling to find out more information, that they have concentrations that are at least 1 million platelets per microliter. That's how we know that it is indeed a therapeutic concentration. So who's good for PRP? Not everybody, but the majority of patients, depending on the type of hair loss that you have, might benefit from PRP. In particular, and the most common is androgenic alopecia, which is male and female pattern hair loss. We do also use it for that telogen effluvium I referenced earlier, and some other harder types to treat, like scarring alopecias, but those do require additional therapies or combination with fat transfer that we're doing here in the office. It can be used as a standalone therapy for those that are looking for less invasive or more natural options than a hair transplant, or those that are not necessarily a candidate for a hair transplant. We also use it in combination with the hair transplant. If you saw the webinar yesterday with my colleague Roxy, she did talk about how Dr. Epstein does use PRP with every single one of his hair transplants now in order to have the healing properties and decrease inflammation, and also to just help aid in the transplant growth while we're waiting for those follicles to take. So this is just quick instructions. During consultation, I'll give pre and post procedure information so that you know ahead of time, or I will email it to you. 10 days prior to your procedure, you want to discontinue any medications or remedies that might increase bleeding. Aspirin or anticoagulants, of course, if you're taking these prescribed by a physician for any number of disease processes, that would have to be with clearance. Vitamin E and ginkgo and some fish oils. That's also something that we want to, make sure that you discontinue. NSAID use, such as ibuprofen or aspirin, and alcohol use about 3 to 5 days before. I like to give Tylenol maybe about an hour before the procedure once you arrive, or some patients will take it before they get to the office to just get that going and help with pain. And then I will take pictures for comparison and put them in your file. Post-procedure, you're going to do I'll do my follow-ups, and you have to be also responsible for making sure that you're coming to the office and working with me or your provider closely to make sure that we get all those treatments in. We do it initially, and then 3 to 4 months after your initial treatment, and then roughly every 6 to 12 months as needed, very individualized depending on your goals. You can wash your hair 8 hours after. I do recommend if you can hold off until the next day, just because I want that plasma to sit on that outer layer of the skin. However, if you have an event, so I usually tell you if you have an event to hold off, but I will provide a baseball cap for you before leaving the office, just to make sure that you're not leaving with your hair all crazy and some blood sitting there on the top. Things to expect post-procedure might be some swelling or some tenderness to the area, which is normal and common, and bleeding should last anywhere from a couple hours to a few days, but you're presentable, shortly thereafter once you wash your hair. It's just a matter of things that you might experience, but to the untrained eye, you won't notice. So for those of you that want to come on a lunch break or something, it's definitely feasible. And then we want you to avoid some salty foods. That's going to help you retain some fluid. So we want to avoid that just for swelling purposes, and avoid anything that's going to irritate the scalp. So if you use Rogaine, you want to kind of discontinue that if it irritates your scalp, just until your tenderness improves. Excessive sweating. So I recommend just, if you want to work out, it has to be something light. Otherwise, you can resume the next day. Sun exposure, most people are not going to go and lay out after this, but I do recommend no sun exposure to the scalp. And hair dye and chemicals. So I would wait a week if possible for those men and women who dye their hair, or you can dye it before, because that can irritate the scalp. I'm going to stop the PowerPoint real quick just so I can let some more people in, because we have more people that are waiting, which is great. All right. All right, let's go back here. Okay. Welcome. For those of you that just came in, I'm just going over the PowerPoint and we can ask any questions. You're all muted, but you guys can ask questions and I'll get to them at the end. So now we're going to talk about the system that I use. So the system we use here in the office is the EMSITE system. The reason why we use this system is it's completely sterile and it has very good efficacy. For those of you who are clinical, it has neutrophil removal while also maintaining monocyte concentration. So those are just white blood cells that we want to make sure neutrophils that we're removing, because in excessive amounts can create some persistent inflammation. And monocytes, which are non-inflammatory white blood cells, they help with tissue healing. During our research, we've discovered that this system delivers platelet concentrations 3 to 7 times your baseline, which is well over what I had previously discussed about therapeutic levels. So, that's a very efficacious result. And it is provider controlled for the end injectable amount, meaning once for the provider and also for the patient to be aware. As you see, those tubes there on the screen are not normal lab tubes. So those are bigger, you get more volume, and you can control the end result of the amount of volume depending on how much you need for the patient without obviously, it's not that we're throwing away any plasma, we just want the highest concentration, which is usually maybe the bottom 12 mLs. So this is just the actual centrifuge, a picture on the right there, or I think, it's right, of the centrifuge. That's just a picture, and this is just kind of how the procedure goes. First, we're gonna see me prepare the field and inject an anticoagulant into the syringe. That does not go into the patient, it's just into the syringe so that we avoid the blood clotting in there. Then local anesthesia via ring block will be performed by myself, or a physician, or hopefully a physician or a nurse practitioner or PA, anybody who's treating you. This may be the most uncomfortable part for the patient, although I do have some techniques that we can discuss after to help with pain during this process. I am aware that there are other places that don't use local anesthesia, but we do like it here. It tends to make the experience better both for the provider and the patient, and puts the patient in unnecessary pain without using it. Then the collection of blood will be done via it's a butterfly for those of you that get your labs drawn with a butterfly. But it is a little bit of a bigger gauge than you would expect, only because we want to make sure that those platelets are protected as we're drawing that blood nice and slow. Then the blood will be pushed into the tubes, and then centrifugation will begin, and we'll use counterbalances. Once all of that is done inside of the centrifuge, we'll aspirate the plasma that's going to be injected and then begin to inject the area being treated and finally activate it. There are some controversies that I wanted to discuss. There's many ineffective systems, and we won't be going into names, but like I mentioned, we have done our research and we have seen the amount of platelets that we're getting, concentration that we're getting with the EMSITE. So we do believe so far that this is the best one we've seen. Inexperienced or non-licensed providers, as I mentioned to you, there are plenty of other places that can perform PRP, but you want to make sure that you're getting this information about the concentration levels and the system and the anesthesia and all these things in order to make an educated decision regarding where you want to get this done, to avoid going to somebody who maybe doesn't have the most experience in doing this. There's a lot of variability in the techniques used for the PRP, and that's just because there's not enough randomized controlled trials yet to set the standards for hair loss. And lastly is patient compliance and follow-up. As I've mentioned, you are going to need a good amount of follow-up coming into the office, every 3 to 4 months, and making sure that you're sending pictures and working with your provider. So that's something that is also on the patient, on you, to make sure that you're coming into the office and being responsible. Because if you just do one treatment, you may not get the results that you're hoping for. And even if you did, they may not last for more than a few months, particularly with androgenic alopecia, which is something genetic. So these are just some pictures of some results in progress. As I mentioned, it's an adjuvant therapy, so it's not something that we recommend just to do alone, although you can certainly try depending on your degree of hair loss. On the left, we have a young male patient who's also on Propecia. And on the left is before he started any therapies. And on the right, you have after 2 treatments, 3 to 4 months apart, and also Propecia daily. So as you can see, he's got much improved in the scalp visibility, and likely he'll be wanting a transplant in maybe about a year or less, depending on his results, to get full coverage for that crown area. On the right, we have a young female patient who has genetic hair loss in her family. And so on the left is before. As you can see, she has that typical widening hair part. She's also taking vitamins. Here in the office, we recommend Viviscal or Nutrafol. And on the right, you can see some improvement in her hair part after 3 treatments, about 4 months apart. As you can see, this is a slow progress. And like I said, it does require follow-up, but there is some improvement there. And this is PRP with a transplant. So on the left, obviously, this is not something you can achieve just with PRP, but there is a place for it with maintenance with your hair transplant. So on the left, you have prior to a transplant at the hairline. On the right, you have it after the transplant and about 2 treatments. And then at the bottom, your 1 year post-transplant with 3 PRP treatments. So as you can see, it's provided a lot of density and made the hair thicker just with the PRP after that initial transplant. So I'm gonna let a few more people in, and then we're gonna switch over to foundation light therapy. Give me 1 second. More people in. Okay. Okay. So now we're going to foundation light therapy. So these are the laser caps that I was discussing earlier. And so here in the office, Dr. Epstein has manufactured 2 different laser cap systems, the foundation light, the standard one, which is the shell, the standard model, and then the Optima, which is the one you see on the right, which has a little bit different fit, and it's vented, and it has different sizing for you and has a little bit more coverage. So the thought process behind lasers are, ours are 300 low-level laser diodes that penetrate through the surface of your scalp and stimulate beneath the surface cell respiration, and it increases your blood flow, obviously allowing the follicles to work more effectively, similar to the analogy I made of the soil and the flowers earlier in my presentation. It also reduces thinning and provides new growth. They're FDA approved for hair loss, and they're quick and easy treatments. Ours in particular are used for 5 minutes every day or 10 minutes 3 times a week on alternating days. So Monday, Wednesday, Friday, Tuesday, Thursday, Saturday, whichever is more convenient for you. We have tested the efficacy with either one of those options, and they are the same. It's travel friendly for somebody who already has an established routine, such as using Rogaine at night. This is a great option. It actually helps if you put the Rogaine on first, or the minoxidil, and then you put the laser cap on, as those lasers help to penetrate and absorb the Rogaine. So for somebody who likes an established routine, the laser cap is a great option versus maybe the PRP for somebody who doesn't really like a daily routine. That's a better option, as you know, you only have to come a few times during the year. So we've had 2 devices with different coverage, and these can be used as early as 1 week post-transplant. The controversy with these is that there's many copycat models, and there's different options for you. There's laser combs, there's laser helmets, there's bands, but those require a lot of patient responsibility and incomplete coverage, especially with, for example, the comb. You have to hold it in certain areas, or the band, you have to move it around. So with a cap, it's covering, primarily mostly the hairline, the mid scalp, and the crown. And so you just have to put it atop your head. You don't have to really think much. We do offer great customer service here, which is hard to find when you purchase the laser caps, through bulk online like Amazon or anything like that. We do offer 75% money back guarantee within the first year of using our laser. If you don't like it, or you haven't seen results, or you feel like maybe some patients travel a lot and are not taking it with them. And we have provider support, which is obviously the most important point here. We individualize your treatment plans. It's not just a number. We're not just selling you the laser. If you have questions, you're available to me or to Dr. Epstein. If you wanted to increase your treatments or decrease or add something else, or just want a little bit of conversation regarding your treatment, we're here for you. And so that photograph on the right is just showing you how the follicle will change during and after that light therapy session. And lastly, I'm happy to announce, obviously, for those of you that have attended, I'm going to be giving $100 off PRP or laser for attending. And then for any first responders or healthcare workers, we're going to be giving special pricing. So if you want to message me for details, my email is at the bottom. And of course, any more in-depth questions or anything else, I know I'm going to take some questions now, but if you have any other information or things you want to ask or comment on, you can go ahead and email me. My email's there at the bottom. And I'm just going to stop share here so I can look at some of your questions. How's everybody doing? I know it's a lot of information, I know. Let's see. Let me put my video back on. Okay, so I'm going to go to questions now. Let me put my video back on. All right. So, your messages. For those of you that kind of came in late, just so that you know, we're recording this also. So we're going to be putting this on Dr. Epstein's YouTube channel. That way you can see anything you missed, look at the PowerPoint. And like I said, I'm still available to ask any questions after the fact. Okay. Do you recommend any oral sedation before the treatments? Okay, so that's a great question. We can, if you have, if you're getting the procedure done here in the office and you'd like some sort of oral sedation, but of course you need to be, that requires a little bit more care, just because you can't be driving, you're gonna have somebody come pick you up. I have given Valium before, just a small dose to patients orally, nothing IV. To kind of help them if you're somebody who is maybe afraid of needles. Obviously, you're going to have lots of needles being injected into your scalp, although we do use the local anesthesia, and that helps tremendously. We have used oral sedation in the past, but most patients, I would say 97% of our patients are fine with just Tylenol. And I use a little, I don't know if you've seen it before, it's a little vibrating T-bar. Actually, Jose, do you think you can get one for me? So I can show them the vibrating T-bar? Yeah. And I use that when I'm injecting the local anesthesia, and that helps tremendously, kind of just distract the patient. And depending on the patient, we have great conversation. And, I recommend clinicians just to write little information about the patients as you see them, particularly for the PRP, because it's so much time in between maybe when you see them. So I always recommend just, I'll put little notes about, my patient was getting construction done, or their son is getting married, and that's why they're doing it. So when they come back in 3 months, I'm like, hey, how's the construction going, or how was the wedding? And so you kind of just, so people tend to feel more comfortable. I have some patients that put on their AirPods and conference call, and that's okay too. So it really just depends on the person. So this is the T-bar, and basically, obviously, there's a sterile sheath that goes on top of it, but I don't know if you all can hear it, but it vibrates pretty loud. And so basically I'll put it right where I'm injecting, and so that helps a lot. But to answer in short, yes, there can be oral sedation. After a hair transplant, is it recommended to do both PRP and laser, or just one or the other? Great question, Tim. So you can do both. We've had patients do both. Like I mentioned, Dr. Epstein, at least for us, we do a PRP with the transplant. So you're not going to get another one for that 3 to 4 months. So in that time period, if you want to start a medical therapy, you can certainly purchase the laser cap. And we do give a nice discount to those patients that would want to purchase a laser cap or PRP in conjunction with their hair transplant, just, because they're a valued client of ours. But you can do both, just because you're going to have that window where you're not going to be doing a PRP. You don't need to do a PRP, a couple of weeks after you got one with the transplant. Frankly, it's unethical for us to, at least in our practice, we feel, to have you do another PRP when you just did one, given the amount of concentration that we're getting of those platelets are still working. so there's no need to do one right after. So you can do both. If you want to just pick one, then you can do the laser, because that's something you can start right away. How much does the laser cap cost? So as I mentioned to you, the controversies of laser caps, there's many out there. Ours in particular retails at $1,500, which is well below some of the other ones that are equal as far as their laser diodes and their wavelengths. So ours is $1,500, so it would be for those attending $1,400. And it does still come with the 75% money back guarantee. And that would be for the foundation light laser. The Optima, let me show you here because I have them here. So the foundation light laser, I got my show and tell. That one, that's a shell, fits underneath the cap. Okay, so it's concealable, although obviously, oh, you're gonna let me put it on your head? Okay. This is Jose, guys. So you can see it just fits. I mean, I don't think that you're going to be walking around for, it's only 5 minutes, but you can if you wanted to. Okay, so it just fits on the top of the head, and it has coverage, all the way to maybe mid crown and the entire hairline. Then your Optima, which is the one that has 3 different sizes. This is a display one, so it doesn't have the diodes, but it's snap on. So if you wanted to change the actual size of the band, depending on the size of your head, you could. So basically this one obviously has much more coverage just from the hairline all the way, if you turn to the side, down, and then turn this way all the way down the back. So it really just depends on what you're looking for. This one is more of a custom fit, and obviously just the style of it requires additional income to make it. So this one is priced at $3,000. Again, with the 75 money back guarantee and the warranty, lifetime warranty. I have read that microdosing is better for PRP, as if the dose exceeds a certain threshold, it doesn't work. Your thoughts? Do you mean, yes, there's a certain, you mean and that's more of a clinical question for those of you that are not too interested or don't really understand. I think, Lynn, are you trying to ask that if there's more than 7 times baseline? Because there is a window where it can be too much. So we do that 3 to 7 times baseline. We have seen some maybe 8 or 9, and obviously it depends on what you're looking for. Again, this is super individualized. That's why we like the M site, because it's provider controlled. So if you wanted to put a little more or a little less, you could. So there is something, you don't want 20 times your baseline, but there is a range, and we like that 3 to 7 times. But give or take, a little bit more, it's okay. We don't want it to be, 1 time your baseline or essentially whole blood, because that doesn't make sense. So you want to make sure that you're somewhere above what your normal baseline platelets would be. How do you make PRP not painful? What is your approach for anesthesia, and what size of needle do you use? So lidocaine, we use lidocaine with epinephrine. So lidocaine, if you've ever had a cut and needed stitches or anything, it hurts. It hurts, it stings. Some patients say it burns. But we do, so one of the things, which is what I mentioned here, you do the tracking technique. So basically what you want to do is that you're injecting an area that's already been anesthetized. So the first one is obviously going to hurt. We start in the hairline. And so when you inject it, you're using this little vibration tool. I'm using this tool. Obviously you have also Tylenol on board. Let me admit more. I keep saying patient. You're going to use this and you're going to track it. So if I put an anesthesia here, I'm going to wait till that area is numb, and then I'm going to inject a needle here. So that way, you're really only feeling the first few of them. In addition to that, speed is a big factor. In patients that are very sensitive, I even use a 1 cc syringe, which definitely takes some time. But that plunger for the provider on a 3 cc, you're gonna push more, and the speed of which you inject can cause additional pain. Also, I inject as a withdrawing instead of injecting on the way in. What else? Little tools. Obviously, that distraction technique. You can use ice if you'd like, but usually this works better than anything. I've had some really nice results, and I've done some trials with patients that have allowed me to kind of inject with and without it, and it does make a big difference. And the size of the needle. I use a 30 gauge needle. I use the longer one for the actual anesthesia, and then I use a 1/2 inch for the actual PRP being injected. What is the YouTube channel name? It's the Dr. Epstein's channel. I'm pretty sure that it's on his Instagram. If not, I'll get that for you. I don't know if maybe Jose or Jackie, you can look that up for me. I want to say it's Dr. Jeffrey Epstein, but I'll confirm that for you, Tim. Is there any discomfort after treatment, and what type of painkiller do you recommend for afterwards? Okay, so discomfort after treatment, yes, as I mentioned, just tenderness to the actual area that was injected. Similar to, you know, just what you would feel if you had a bruise on your arm, you know it's there. As long as you don't touch it, it's kind of fine. So most patients, they'll tell me they'll forget and then they'll do something like this, or when they're washing their hair, I tend to tell patients, be gentle with yourself. So you don't want to scrub like we normally do when you get back to your normal hair washing routine. Just kind of be a little bit more gentle, because you'll be tender to touch. As far as swelling, that would be the other thing that maybe you might experience kind of at the hairline, and that's just from the anesthesia that's being injected there. Typically the hairline requires a little bit more anesthesia, as it tends to wear off faster. So that's where you'll see maybe some swelling, and obviously just gravity from just, you know, if you're sitting at your desk all day. So ice, I usually recommend to tell patients to just massage this area out, and you'll see that it'll go away. You can put ice there. And then the only other thing is maybe sometimes a little bruise. Usually you can cover it up. We tend to be pretty, you know, veiny here in this forehead area. I don't know about you guys, but I usually have one that pops out if I'm hot or if I've been drinking. So if you have a vein there, you know, that I try to avoid them as much as I can if I can see them. Sometimes, you know, it just varies from person to person. So really, that's the only thing. And as far as painkillers, Tylenol. I recommend extra strength Tylenol. So you can do 2 of those every 6 to 8 hours. But most people, I follow up with you in about 6 or 7 days just to see how you're doing. Most people are okay by that time. If there's any lingering discomfort or tenderness, or areas that maybe are still numb, those nerves that have taken a little bit longer, depending on how you filter out the lidocaine, you know, that can happen, and Tylenol is usually okay. And then after a week, if you still have anything, Advil is fine if you need kind of more anti-inflammatory properties. Let's see. Because of a lot of questions, I'm trying to answer as many as I can. Seems to be the PRP was the hot topic. Oh, it's the Dr. Jeffrey Epstein channel, Tim. So Roxy just answered for you. Are they good to use even if you had not had transplants within 10 years? The PRP, of course, you can do. I mean, we have patients, like I mentioned to you, most of the patients in the pictures that I showed are young and either not ready for a transplant, or like the female is not interested in a transplant. And you can, you know, have patients that are in their 60s and 70s just kind of doing this just to kind of maintain. This is something fairly new, as I'm sure you've seen this whole PRP craze. So this is something that, I mean, plenty of patients that have had transplants years ago or never at all. So you can totally do it post-transplant, even if your transplant was a long time ago. Now, if you did a transplant and you only have those hairs and you're completely bald in the rest of your scalp, we have to be realistic. And that's one of the things that goes into the ethics and why a consultation is important, because Dr. Epstein and myself will be very honest regarding whether we think PRP is a valid option for you, or if we need to go a different route, because it's just not something based on your goals that would be realistic for you. What is the price of the M-site kits and system? We have used the Harvest system, but it's not relatively high RBC and WBC concentrations, not ideal. And red color is not appealing. Yes, red color is not appealing. Yes. I will get that information for you, Javier. That is obviously, I'm not sure if you're a provider, but I will get the information and I will get you set up with our rep, who's amazing and can answer any questions for you. And I'm happy to help and get you the information regarding purchasing the system instead of the Harvest. M-site is awesome. How much cc's of blood should be taken for the PRP? From the patient, we take, if we're doing the double spin, we take 60, it's a 60 cc syringe. So if I have kind of been already mastered the technique of doing everything kind of one-handed and by myself, depending on if I'm able to have somebody assisting me. But I definitely recommend for those of you who are providers and maybe going to start using the system to have another person with you, so that they can be drawing the blood, or you can be drawing the blood and they can be your other hand, because the plunger on a 60 cc syringe can be difficult, but it's 60 cc's from the patient. Do you recommend any labs before treatment? We usually order labs in consultation if you're coming in for a consultation for hair loss specifically. However, the thing with ordering labs before is that your platelets vary throughout the day. They're higher in the morning. So in reality, unless you have any chronic conditions or reasons why we might be concerned about platelet count or things of that nature, you don't necessarily have to, we don't necessarily order labs on every single person right before a procedure because they can fluctuate. You know, the assumption is once we did your CBC from consultation that your platelets are remaining in your normal ranges. Do you do PRP for anemic patients or pregnant? We do not do PRP on pregnant patients, and it depends on the anemia and what your labs look like. So if you are anemic, you would be somebody that I would definitely order labs on and see what else is going on before we, do anything like that. How deep do you go with the needle for anesthesia and PRP? That's a great question. So for the actual PRP, I use the 1/2 inch and I go all the way down, and I want to make sure that I get every single layer, even the top layer, right? So I go down and I inject that PRP as I'm coming up because I want to make sure we get every single layer of skin. And then for the actual anesthesia, pretty superficial, not very superficial, but you want to make sure, you don't want to avoid any vasculature. I'm using lidocaine with epi. Okay, so you want to just, your normal depth when you're using lidocaine. Okay, it doesn't have to be super deep. You want to avoid going super deep because it can also just, it can be very tender. During hair transplant, when you give PRP just before or immediately after you inject or spray over the grafts. So when we do the PRP with the hair transplant, we're doing it before Dr. Epstein or Dr. Brad start to make recipient sites. So we're not disrupting the grafts. Okay, so that would be, and if you saw Roxy's webinar yesterday, she kind of went over the process for the patient that if you're assuming you're doing FUE technique, you're on your belly, and then you're going to turn over. So when you turn over, typically that's when we'll go ahead and draw the blood and prep the scalp, and that way we're already using the anesthesia that we're using for his graft, for his recipient sites. We're taking advantage of that anesthesia and using it for the PRP injections as well. You can give them my email. Oh, okay. Can we perform PRP with topical anesthesia like EMLA cream? You could, but it's not really going to be effective. Remember, EMLA needs like a clean surface. It's kind of like putting an ACLS, right? Like a pad, right, on hair, right? You're not going to get a sticker on hair, right? So it's the same kind of concept. You're not going to get good coverage or good anesthesia from that. This needs to be deeper. Remember, you're talking about injecting that into layers of the skin, and with the PRP, you're going all the way down. Another thing I didn't mention for pain, you want to make sure that you're changing the needle. The more you use a dull needle, the more it's going to hurt. So constantly, so an assistant is helpful in making sure you're having a sharp needle, because that's going to be something that after a while, if you're using that same technique, it's using a dull needle. If you have to really shove that needle in there, it's time to change it. You want to make sure it's nice and sharp. I have been using the laser cap. When I bought it, it was instructed to use it 3 times a week or every other day for ½ hour. Depending on when you purchase the laser, the systems have changed. So if you purchase the laser, that's never been with this current laser. But there are other models depending on the diodes and the wavelengths. So as we've learned more, the lasers, obviously they've changed the efficacy. And so the more research we do, so it really just depends. Carol, you can message me about the type of laser that you purchased, and I'll look into it. But these particular models that we've come out with, the foundation light caps, are 5 minutes daily or 10 minutes 3 times a week. Is there any excessive swelling after PRP for treatment? There shouldn't be. As I mentioned, you can have that swelling on the forehead, but it shouldn't be anything, out of control in comparison to any other type of swelling. It's just a sensitive area. Again, it depends on how much lidocaine we needed to use to achieve anesthesia to the hairline, but no, there shouldn't be excessive swelling. How many procedures have you done and how successful is it? Well, I do, including the hair transplants, Jose, 20, 30 weeks. What did you see? The PRPs, hair transplant and standalones.
Oh, yeah.
Yeah, maybe 30 a week. So quite a few. And how successful it is, as I showed you some results, they vary. That's why I wanted to show you a young man, a young woman, somebody with a hair transplant. It really just depends on the person. The percentages can be anywhere from 60 to 70%, but most people are on an additional therapy. So a vitamin, a laser, Propecia, some other therapy, standalone, you know, it depending on also the type of hair loss. If it's a genetic type of hair loss, we need to combat that from all different angles, right? So medical therapies, Dr. Epstein in consultation usually will say, you know, do one or two things, not just one thing. Oh, you guys have a lot of questions. I'm gonna have to start skipping some. I have permanent alopecia due to chemo. Do you recommend this treatment for me? That is a very specific, individualized question. We'll have to talk one-on-one, but we would have to talk about that. So that's something, Maria, I will message you separately because it depends on the degree of the hair loss. Ultrasonics, PRP, any advantage, age, safety for laser cap, role of PRP in alopecia areata. I'm not sure what ultrasonics is. I imagine it's a type of system. I don't know about that system per se, since I mentioned we only use MSite. Age, safety for laser cap, age 18 and older. And the safety is great. You're not putting anything, this is not penetrating to your brain. This is not anything, we obviously for pregnancy, I don't recommend anything until this is cleared by your OBGYN, but there's no downside. There's no downside for the laser cap, it's very safe. And then role of PRP and alopecia areata, again, it really just depends. Want to make sure we do a biopsy to confirm that if you're doing alopecia areata and it's not working. And then we do use some other therapies before we would recommend PRP specifically for alopecia areata, since it tends to be something that comes on from stress and inflammation. So we do use some other therapies that maybe, if that's something that you all are interested in, we can talk about in another webinar. Good point. Okay, so somebody's asking here privately just about NSAID use after the treatment. Again, like as I mentioned, Tylenol. And then if after a week you're still having any lingering tenderness or pain, you can use anti-inflammatories after that. So for 7 days, you still want to avoid those NSAIDs. And then usually when I do my follow-up, if they say, hey, Andrea, you know, I'm still having, you know, random tenderness, I'll then say, go ahead and do Aleve or Advil after those 7 days. And then as far as icing goes, when I say icing, I mean to any areas of swelling. I don't want you to ice to where the PRP is, because icing is going to limit blood flow to the area, which is what we don't want. It's a vasoconstrictor. So when I say icing, I want to clarify that it's where they're swelling. You know, maybe if it's gravity, you know, sometimes it will kind of come down. And so that would be where I would say icing. Do you offer any discounts for prior Dr. Epstein patients? Yes, of course. So obviously, like I said, that's individualized. If you're a client of ours, whether you've had a transplant or are somebody who was seen many years ago, and obviously, as I said, PRP is something fairly new. If you would like to come in for a consultation, those are obviously no charge consultations, and then we would offer discounted prices for you if you have been a patient in the past. I think. About the ultrasonics, I'll have to write that down and look into it a little bit more, and I can email you, if you put me your email address, my thoughts on the advantages of that. Since I'm not too familiar with it, I'll have to look into it. But I know that there's another system, jet peel, I think that maybe might be similar to what you're talking about, but I'll look into it and I'll email you and get back to you, okay? I think that was kind of the last of the questions. Does anybody, I'm gonna unmute you. Anybody have anything else that they want to say before I just sign off? And just, again, I'm so grateful that you guys came in. I know everything that's going on is very scary, and hopefully, you know, I'm eager to get back into the operation and continue to treat my patients. In the meantime, for those of you that are currently in treatment and are, you know, wondering what to do, continue your home regimens. Obviously, if you're interested in purchasing laser caps, we can get that out to you. Therapy, of course, until we can get back into the office, is something we have to wait. You can ship your vitamins, and if you have any other questions of home, depending on your needs, email me again, Andrea at shrps.com. And I'm happy to answer any questions. I will make note of the specific questions so that I can get back to you, and I'll talk to Dr. as well. If you guys have any. Marcia, you just came on. Don't worry. This was all recorded, so we'll put it on Dr. Epstein's YouTube channel, okay? No worries that you're late. I know there's a lot going on, okay? If anybody doesn't have any other questions, I think we're good to go. Again, remember that for attending, you can get $100 off PRP or laser caps. So if you're interested, let me know so I can make sure I write that down for you. If you're interested in the PRP, again, the laser we can ship out to you. And if you're a healthcare provider or a healthcare worker or first responder, or anybody working, I am so appreciative of everything that you all are doing out there, and we will make sure to get you some special pricing. You're very welcome. All right, guys, have a good day. Enjoy. Bye-bye.